There are over 70 million adults living with disabilities in the United States. We know that individuals with disabilities do have poorer health outcomes. And so when we think about healthcare disparities, we have to say, but these don't have to happen. These are not necessarily associated with a disability itself. These are constructs because we don't know how to provide a care that fits for them. The Center for Disability Health and Wellness is to allow us to begin to put together the pieces. Healthcare disparities are a complex topic, and no one person can really address it.
CDHW really allows a very interdisciplinary focus where we have clinicians, we have researchers, we have community stakeholders, we have patients, everybody coming together to really identify these different issues. Coming together helps us to get a better understanding, and hopefully we can target those gaps.
With the model of healthcare disparities, though, what we did was we added kind of this intersection. Where is the healthcare system, and what is its unique role in terms of providing that match, understanding where the person is coming from? Is that clinic, is that system allowing people to get in the door? Is it providing ASL interpreters? Does it have the lifts to allow people to get appropriate examination? Is the durable medical equipment available? Are the imaging techniques accessible to folks who cannot independently navigate them or stand up? A piece of that is also our individuals with disabilities being identified so that the care we provide as healthcare providers, as healthcare systems, directly and correctly identifies and addresses what they need.
It's really very simple. A person with a disability has as much right to have the exact same care as somebody who doesn't. Clinical implementation is really important, and it looks like education and really doing your homework in its preparation. 100% of the time, people say yes, they want to be able to do this. So what might look like something that's inaccessible, and people might think, oh, well, look at, they're not doing that work. It's probably because they just don't have the information they need. So it's so critical to educate and then work with these clinics to make sure that they're prepared and ready to provide care. What we create is called the Disability Tab at Michigan Medicine. It's very unique to Epic, and we built it in-house. And so what that does is it allows for these clinics to know in advance the patients with disabilities or their families are able to indicate what their disability is and what kind of accommodations they need. And so prior to that appointment, those clinics can look and see what it is that that patient needs in order to have accessible care for that appointment. CDHW was pivotal in pushing that through, and then also creating guidelines to work with all the various different disability groups on how can you provide accessible care. So it's about educating.
We have a deaf health clinic here at the Department of Family Medicine, the University of Michigan Medical School. It's been set up and designed to be a model clinic. The reason why it's a model clinic is because we have engaged multiple stakeholders to think about what are primary care areas that we need to make sure that they're accessible. We're really sort of like the initial sort of think tank, the initial guide, and so hopefully we can start to create change across the healthcare system.
We need people who are key decision makers to think ahead and plan ahead to be able to provide what we would call more of a universal design, providing access from the beginning, A to Z access, to make sure that the hospitals or doctor's offices, wherever you're going for your medical care, those services and that access is there. Any of the needs that the individuals have, to make sure that those that are appropriate for it are provided to those individuals when they get there. Again, myself as a deaf person, this is incredibly important.
Collaboration is very important. Those who's closest to the problem are the closest to the solution. Having the community that you are trying to help be partners in the solutions and things that can be effectively, help people's health become better.
I view the future of healthcare for people with disabilities is that we provide an unbiased, equal access to healthcare. And that means healthcare providers across the spectrum. Healthcare providers that are educated from the very day they walk into their health professional schools to the day they leave, and additional training they have afterwards, so that they understand the needs of the individual with disability.
Mainly, I hope that we're seeing individuals with disabilities in healthcare, not just as patients, but as partners, as providers, as leaders. That is, I think, what is going to allow healthcare to flourish, what's going to allow it to really get to the next level in understanding and improving people's lives.